Assalamualaikum warahmatullahi wabarakatuh. We are from Group 4 and now we like to present about the lack of psychological testing in Malaysia. My name is Aisyatul Radhiah binti Musa and my other group's members are Siti Aqilah binti Zahruddin, Nur Liyana binti Mohd Roze, Hana binti Abd Aziz and also Nurul Afiqah binti Aradin.
Assalamualaikum warahmatullahi wabarakatuh. The title of our group is The Lack of Psychological Testing in Malaysia. For introduction, psychologists use tests and other assessment tools to measure and observe a client behavior to arrive at a diagnosis and guide treatment. In many ways, psychological testing and assessment are similar to medical tests. If a patient has physical symptoms, a primary care provider may order X-ray and blood tests to understand what's causing those symptoms. The result of the test will help inform develop a treatment plan. Psychological evaluation serve the same purpose. Psychologists use tests and other assessment tools to measure and observe a client behavior to arrive at a diagnosis and guide treatment. If a person is having problem at work or school or in personal relationship, tests can help psychologists understand whether he or she might have issues with anger management or interpersonal skills or certain personality traits that contribute to the problem. A psychological assessment can include numerous components such as norm reference, psychological tests, informal tests and survey, interview information, school or medical record, medical evaluation, and observational data. The testing and assessment process will help ensure that the client receives treatment that tailored to his or her individual needs. Next, we move to problem statement. First of all, what are the difficulties in the pre-authorization process? One substantial problem in the authorization process is that reviewers often work from standardized authorization protocols that prescribe appropriate clinical criteria needed to authorize psychological assessment, including standardized time or service units within which to accomplish the service. This authorization is often determined without regard to confounding variables in the assessment situation that might indicate, even before the testing session, that this particular evaluation will require more time to complete. Once a request for authorization for psychological assessment reaches the MCO, there can be other problems. Psychologists report dealing with MCOs that have no psychologists either in authorization review position or even available for appeal of a denial, which is appellate review. Federal and state advocacy to encourage appellate review by a licensed provider is increasing in consumer protection legislative initiative. Passage of this initiative would ensure that appeals of assessment and treatment denials would be heard by professionals with expertise in the service being requested. Authorization is often test-specific. This does not allow the psychologist to tailor the psychological assessment better to meet the unique needs and characteristics of the patient when these are not evident at the outset but emerge over the course of the assessment process. As a result, psychologists are professionally bound to perform the tests necessary to investigate questions as they surface, without any assurance that they will be reimbursed by the MCO. Payment is even less likely if there is no pathological finding on the additional test, even though they were indicated by the initial clinical findings. Psychologists also report that the authorization process takes too long and that, particularly with at-risk adolescents, some of the patients have deteriorated, moved or run away before the authorization request is reviewed. Moreover, reimbursement for specialty service, including psychological assessment, is often included in a hospital fees per diem or daily rate. This provided inpatient units and treatment teams with a financial disincentive to order psychological assessment because its cost will reduce the funds available for other services.
Assalamualaikum warahmatullahi wabarakatuh. My name is Hana binti Abd Aziz, metric number 1182681. Okay, another lack in psychological testing is lack of awareness and culture and stigma associates. According to Suradi Salim, he conducted a study among college and university students in Malaysia on awareness in psychology. Among them is the lack of awareness regarding the severity of problems, culture and stigma associated with psychological problems. According to RICO, a study of Malaysian on knowledge of psychology and mental health shown that almost 90% do not have good knowledge of psychology and mental health, and it is leading to less interest seeking in psychological profession on mental health in Malaysia. Chian and Louis investigated on the effect of appreciating and receiving social support of Asian and Americans on psychology, where there is a negative correlation in Asians. From the study shows that Americans get positive social support for psychological seeking, and that influences them to do research on psychological. Because of that, many psychological test instruments are adapted from the West. So, the conclusion is lack of interest in psychological tests makes Malaysia less producing a new instrument, cause them to take an instrument from Western culture.
Okay, for the quality of the instrument, as we know, most psychological testing in Malaysia are widely adapted from the Western. So, in terms of authenticity, the psychological testing instrument in Malaysia are quite different and less because many instruments in Malaysia have been adapted from the Western. So, next, in terms of language, language inaccuracies in the translation into the family language, most psychologists or counselors will take the instrument from the Western, so some of them will translate from the original, for example English to Bahasa Melayu. Okay, the translation process is challenging for use in one culture and language which is contain different semantic, idiomatic and cultural. Then there will be some words that we are not always used or heard, so it will increase doubt or question for those who want to take the test. Okay, although many Western tests have been translated, the quality of the translation and adaptation varies.
Second, effect lack of instrument psychological testing in Malaysia is does not describe the actual result. The underlying cause of a person's problems is not always clear. For example, if a child is having trouble in school, does he or she have a reading problem such as dyslexia? It doesn't mean they have dyslexia. An attention problem such as attention deficit hyperactivity disorder, which is ADHD, difficulty with impulse control. Okay, psychological tests and assessment allow a psychologist to understand the nature of the problem and to figure out the best way to go about addressing it. Okay, psychological tests are not one size fits all. Psychologists pick and choose a specific set of assessments and tests for each individual client, and not just anyone can perform a psychological evaluation. Okay, then is lack of client confidence to use test results, because in terms of a Western perspective only and non-Muslim perspective. Okay, as a Muslim, we always want to use something that we trust, and not all people easily trust it, especially when all the theory adapted from Western. So it is too hard to certain of them to trust it. This is the same issue happen in Malaysia, and sometimes it's may lead to biocultural issue.
Last, we go to the conclusion of our study. Okay, now the lack of psychological testing is indeed a discussion among psychologists. In this study, there are several issues that cause a lack of effectiveness of psychological testing instrument. Among these issues are lack of awareness, cultural and stigma problems, and other else. Such an issue can affect either the psychologist himself nor the client, such as not being able to describe the actual results and lack of client's confidence. It can be seen that the psychological tests in Malaysia are following by Western ways, and until now still lack of information relating to the improvement to this problem. Alright, that's all from us. Thank you.